serve will be Sam Zappia. Sam is the Country Programs Manager for Care Australia, and he's been active in development and poverty reduction for more than 30 years. The country's program team within Care Australia is in charge of the design and delivery oversight, the results reporting for all development projects funded from Australian sources. And I saw quite a few of them with my own eyes in Nepal. Care Australia currently funds projects across 21 countries. The main sources of funding are DFAT and the Australian public, as well as corporations and other private donors. Sam will talk tonight about Care's work, highlighting its particular focus on women and girls. And he'll also highlight Care's strong accountability and transparency framework and talk about Care's risk management approach. He'll also be touching on the current operating context in Australia for the development aid sector. Ladies and gentlemen, please welcome Sam Zappia.
Good evening, everybody. And kind of like I'll see if I can't sort of bring the house down. Not literally, of course.
A bit louder.
So thank you very much for inviting me here tonight, and it certainly is a pleasure to be able to talk about international development assistance or international aid. As noted, I've been in the sector for certainly at least 30 years. And as Bill has mentioned, working in this sector, I guess for those who don't work in it, trying to explain the complexities that we have to engage as being part of the sector and trying to deliver effective aid is not often well understood. So I'm hoping that at least tonight I can give you at least a slice of how Care Australia goes about its business. But I also, I guess I can reflect, having worked for most of my life in the Australian government and I guess I can have perhaps a few little comments around the changing operating environment, and particularly around Australia's aid program. As we heard earlier from Catherine, there is a new paradigm with the new Foreign Minister, or should I say new now because they approach an election, but there is at least a change in thinking about how poverty reduction is undertaken through the Australian aid program. And just apologies from my Chief Executive Officer, Dr. Howes, who will be here tonight, but she has another engagement, so which is why I'm here. Otherwise, I'm sure she will be very pleased to be making this address tonight. Exactly 70 years ago, American citizens were feeling desperate to do something personal to help those in Europe. They were spurred by powerful images in the media of immense food crisis. 6 of the most destructive years in history had come to a close in the summer of 1945. Much of Europe lay in ruins. Factories, farms, railroads, shipping and homes destroyed. 30 million people were dead, and 13 million more were refugees. Fuel, shelter, food was scarce. The food crisis and rationing captured nearly as many headlines as post-war political developments. As the crisis grew, Americans campaigned for a reliable way to send help directly to family and friends in need. And so, Cooperative for American Remittances to Europe, CARE, and the CARE packages was born. Britain and other European countries were many of where we came from, were some of the first countries to receive international aid. Obviously, CARE has evolved since that time and is now an international aid agency, and it currently is active in 95 countries. So, in that 70 years, it's certainly evolved. But I guess just to note, it started firstly as a means to get aid assistance to pretty much refugees, others who were in need in Europe at the time. Care Australia joined Care International in the 1980s under the leadership of Malcolm Fraser. At this point, our former Prime Minister had been out of office for about 5 years. Some say he was getting increasingly frustrated with the problems in Africa at the time, in South Africa. Unfortunately for us, he felt that working on his farm at home was not enough. So CARE offered him the opportunity to engage with issues that he was passionate about, and he threw himself into the establishment and development of what is now CARE Australia. Malcolm put Australia at the forefront of emergency aid in countries around the world. He wanted to create the Australian face of overseas aid, believing that we had the responsibility and the technical and financial capacity to assist those in need, and in particular in times of disaster. So CARE in its work is particularly focused on humanitarian emergencies and responding to those. We heard about the Syria crisis earlier, and that's certainly one. We have another one going on in Fiji right now. But CARE also works around development, so it's really about looking at long-term solutions. Now, so CARE focuses on the discrimination and those who are disadvantaged, and really is about trying to ensure that the poorest people in the world benefit from a growing global economy, technological changes, and really to ensure that they don't get behind. There has been an extraordinary revolution in the world in the last few years, last really 10 years. So those of you who follow the Sustainable Development Goals, there's been amazing results around health, education, and living standards. This year, 2015, for the first time in the world's history, less than 10% of the world's population live in extreme poverty. This is a remarkable result, and I dare say that aid, international development assistance, has played a significant role in that success and other successes. However, there is more to do. CARE's decades of work in poor communities has underscored the undeniable fact that the majority of the poorest people in the world are women and girls. Women and girls are less likely to go to school, less likely to be well nourished, less likely to own assets or able to inherit. Carrying a higher burden of household work, there are so many reasons why women are overrepresented in poverty. So CARE's proposition is that we will not overcome extreme poverty unless we address the status of women. Our work shows that the most effective way to overcome poverty is to remove the barriers that hold women back. But this isn't a simple scenario in terms of how you get at this problem. We know that just offering a woman a small loan to try and start a business or build some training, build some capacity, that's unlikely to change her life. If her husband doesn't let her leave the house, she's already working 80 hours a day, she's illiterate, then we need to do more to change her world. CARE's approach is to help women and girls to increase their skills and aspirations, but at the same time work with men and boys so that the relationships which women negotiate their lives become more supportive. So it's not about just focusing on women and girls, it's about the social environments in which they need to endure or live with, and sort of cope with, to try and change the dynamics in which they operate. We also look at the laws and customs and social norms that restrict women's lives and diminish their hopes and aspirations, and work with communities to bring about change. This framework drives and shapes CARE's work. So currently CARE operates across 21 countries where working with women and girls certainly dominates the kind of work that we do. And later on I'll just give you some brief examples of the work that we do. Now, accountability and transparency is obviously key to international agencies or CARE Australia, where we rely on public funding, whether it be from the Australian taxpayer or from the general public or from private foundations. So we need to make sure we are sound in both our financial practices and what we deliver. So CARE, for a start, CARE Australia retains all management and contractual responsibility for all funding for projects where we source money out of Australia or from Australians, whether it be through the aid program or personally. We have a dedicated accounting and compliance team that ensures that our contracts and finance standards are maintained and do meet any audit requirements or just audit standards. We get DFAT audits us every 5 years as part of our accreditation process, As we heard earlier, Emily mentioned that to be accredited with DFAT, you do need to satisfy a whole bunch of standards. And so that's part of the accountability and the standards that need to be maintained and how that can be maintained. CARE has a governance structure, so we have a board. We have subcommittees that look at the performance of what we do. We also look at the financial standards. So there's a whole bunch of internal governance arrangements that basically are checks and balances to make sure, firstly, their money is well spent, and secondly, that we're doing a good job around delivering against particularly the kind of outcomes that we want to achieve, which is around women and girls, improving governance, and also addressing issues like resilience, and of course delivering very good humanitarian emergency responses. As mentioned earlier by Emily, there's the Australian Council for International Development, which we're a member of as well. So all of those standards that are applied by ACFID, or the Australian Council for International Development, we're also part of that, contact. So there are a bunch of these requirements and codes that are established that most Australian NGOs are part of. We also, as part of CARE over the last 5 years, have introduced new approaches to ensure that our programs are of quality that we want. So in other words, we have internal processes that demand, firstly, high quality project documentation, that input through a competitive process. So we want to make sure we're clear on what we're trying to achieve, have we got the right solutions or right pathways, and then have we got the right monitoring tools in place, or are we asking the right questions just to check, are we on track? Those sorts of reports and those sorts of performance audits, they are published, so they become public documents, so everybody can read them. We have independent evaluations that say we don't assess ourselves, we ask somebody else to assess our work. That gets published. So that's part of that sort of transparency and accountability that we apply. So for those sort of agencies like CARE Australia, let's say we rely on public funding, whether it be through institutions or the Australian public, accountability and transparency is paramount. Otherwise, we won't sort of raise the funding that we need to do the work that we're trying to do. I just wanted to sort of move to the sort of what is sort of kind of reality in terms of the operating context. As we heard earlier from Catherine, the Australian Aid program is certainly a source of funding that CARE relies on, has relied on for some time. Firstly, there's the integration of AusAid into DFAT, and to some extent that has resulted in a loss of, or at least a dilution of people in the agency that understand or are wedded to development and poverty reduction. So I'm not saying that it's necessarily totally bad, but it does mean that there is now some dilution of that expertise and that understanding and that support for poverty reduction in the Australian Aid program. The other, of course, is the severe cuts to the Australian Aid budget, which we know is now around $4 billion per year. But if you also know the story, that the forward estimates were cut by about $9 billion in terms of what was planned for the Australian Aid program. So there is now a much more tighter environment in terms of what available budget there is. The other is the paradigm of moving more to private sector-led growth. Now that's fine, that's great if you're in that stream of where private sector can get to you. But if you're marginalised, discriminated, you're not in that sort of setting, then I'm feeling that perhaps the Australian Aid program might lose touch with those sorts of people. So that's where, again, Australian NGOs are trying to at least suggest that you need to, the Australian government at least should keep in mind that poverty reduction through private sector growth doesn't always get to everybody. There are still governance issues and marginalised and discriminated groups who probably miss out still. I just wanted to then give you just a picture of where CARE sits in terms of its finances. In 2014-15, so in the last financial year, CARE raised around $42 million for its programs. And how was that made up? So from the community, that is from donations, fundraising, from legacies, people who give in their states. So that's made up 35% of that funding. And then DFAT provided 46% of the funding. And then other Australian agencies, or particularly Department of Immigration and Border Protection, who have done some work with displaced in particularly the Middle East, and made up the other 19%. In terms of how we spend the 42 million, 89% of that went out the door, out of the programs. And in terms of what was retained, 11% of that and 7% of that was to do the fundraising campaign. So we have to do market our product, if you like. So that's the kind of splits, but I guess just to know that 89% of what came in has gone out the door. I want to then just finally give you some idea of the kind of work that CARE does, and happy to answer sort of questions. But I guess it just also want to reflect and reinforce the complexity of the kind of work that goes on in the name of development assistance and trying to get people out of poverty, particularly women and girls. In Timor-Leste, we have a Safe Motherhood project. CARE is currently working directly with just over 3,000 women, men, boys and girls who live in the 2 districts of Timor-Leste. And it's all about trying to overcome barriers to access to and use the provision, to use health services and really to assist pregnant women to receive health and nutrition education. One of the beneficiaries is a woman named Maria, 43 years old, from a remote village in Timor-Leste. Prior to the project, and just noting that this project is funded both by the Australian government, but also through private donations. She had lost 5 children from miscarriage, malnutrition, and measles. The other was a 3-hour walk to the nearest health centre, and during the rainy season, it was in the roads were impassable, so you couldn't get to the medical centre. So through this program, she has learned about family health, about nutrition, about building kitchen gardens, and fertilising her crops. She's also learned about the importance of birth spacing, contraception, vaccination, and the use of a trained birth attendant. So that's just one of the beneficiaries, but it's changed her life. In Zimbabwe, we do a water and sanitation and hygiene project. It likewise is jointly funded by the Australian government and also private donors. In this case, it's the Thank You Group. And those of you buy Thank You Water, you'll note that you can peel off the tag and you can get a coordinate and where to find the well where this project is working. So in other words, you can kind of be a part of this project. So it's really about, and in this particular project is again important to women and girls because during droughts, water availability, of course, is a problem. And that means that women and girls must travel further to collect water, putting them at risk also of sexual violence and abuse whilst they fetch the water. This project has now been running for 4 years, and it's led to safer conditions and water supply for up to 20,000 people in this district called Chin. It's also enabled a water committee to be formed, which has women represented on that committee, so they do look after the maintenance of this infrastructure. They talk to the local government, so there's been some empowering that's gone on within the community, which women have been represented, where previously they had no representation. And finally, I also want to just tell you a story about Papua New Guinea, and partly to really demonstrate the difficulties of doing business, if you like, or working in an environment like Papua New Guinea. CARE has been working in the highlands, eastern highlands of Papua New Guinea, undertaking what's called an integrated community development project. So it works in 3 disadvantaged districts. The population covering those 3 districts is about 78,000 people. Through this project, there have been some enormous benefits around 7,000 children who previously didn't have access to school, now enrolled. We've established village courts, and it includes female magistrates. And the importance of female magistrates is that women are prepared to come forward now and at least get some sort of justice, where previously if it was men they didn't bother because people think they'd be heard. So these have been established, and they now hear 40 cases per week, which serves it serves a population of around 30,000. Local governments assemblies are now meeting where they previously didn't meet. In other words, they sit down and actually talk about what the communities might need, whereas previously they were elected and didn't bother meeting. So this project is facilitated to sort of help people, these as elected members, to be mindful of their duties and then facilitate them to meet. Nearly 18,000 people have improved access through the construction of footbridges. So they used to cross these swollen rivers and people would die as they tried to cross these rivers. So we constructed footbridges using the money of the local member. So it wasn't always paid money, it was actually leveraging what was already available in the district. So the real purpose of this was really just to give you an indication that our staff who work in these places, they were organising a meeting with the local member and the district officials. It had been 2 months since they last met, and so they were ringing ahead saying it's time for us to meet. So they got confirmation, yes, that's fine, so they set up a date, and then the day before they just rang and reconfirmed that's fine. So they got to this meeting and they sort of were allowed in, but they're in the room in front of the district administrator. The room was full of men and women, morning mud covering their faces. The district administrator was in negotiations in hopes of avoiding the escalation of a recent murder into tribal fighting. Obviously our staff thought this is not a good time, so they excused themselves and said, no, perhaps we can meet tomorrow. That afternoon they drove around sort of looking at the gardens because most of these people were drought affected, but there had been some rain, so they was just looking at how the recovery was going. And on the way they passed the local member who was sitting as a passenger in the local police vehicle. He confirmed that they could meet the next morning, but not at their headquarters because there'd been a 2-day power cut. He was on his way to pick up the district administrator so that they could together visit the community where there'd been this murder and there's a way of avoiding tribal fighting. The week before, he and the district administrator had spent much of their time dealing with tribal fighting and multiple killings in another part of the district. These deaths were retaliations following a death which had been attributed to sorcery, which the member believes was that a group had land dispute as the real cause. The next morning our staff did go to the meeting, but there was the Member of Parliament ready to meet with them, but he was busy on his phone because he was trying to understand why wasn't there power in his district. And then the other major concern was how do they fix the printer, which they use for printing the official checks so people could get paid. And I guess just the final point, the districts that we work in get what they called infrastructure support grants. These are development grants that go in block form to district level and they're promised a certain amount. So this particular district had been waiting for their 10 million kina to come through. Now, and they'd also been promised a further 5 million to build health and education facilities and they'd developed proposals. But these come from the national level government and invariably the money never comes. Or if it comes, it's very, very late in the financial year, so they have trouble spending it. So this is just part of the complexity of working with local governments who have the best intentions, but often there are other forces at play. So I just wanted to sort of finish that we're, I guess, an agency that, and there are many like us who go out with the best intentions and work with very good officials, but sometimes there are so many other things that add to the complexity. As I say, you've got tribal fighting, you've got power outages, so you can't run your offices, you're not getting the money that you've been promised. Yet here we are trying to work in this environment of saying, you know, we now want to help you, but you've got to work with us. So I'll finish on that note and just say happy to take questions later.
Sam, thank you so much for that wide-ranging address, particularly for giving us a bit of a breakdown of where the money actually flows to and some of the specific programs that parents are involved in. Really interesting to hear that level of detail. Ladies and gentlemen, it is time for a short break of 10 minutes. We'll resume at 8:10 for some Q&A sessions. Please enjoy the delicious fare if there's any still on the plates, but it looks like it's been well and truly cleaned up. Have some repartee with your fellow diners and we'll be ready to go in about 10 minutes. Thank you.
So